Hi, my name is Tim Vander Wilt. I'm a physical therapist at Kinetic Edge Physical Therapy in Ames, Iowa. I'm going to be doing a short seminar or presentation on vestibular rehabilitation and some things that physical therapists will do for a specific type of vertigo that many people will experience. So the first thing I just want to define vertigo. It's a sudden sensation of dizziness. It's usually described as a spinning or rotational sensation while an individual is stationary. So a lot of people will describe it as the room is spinning, and they are standing still with the room spinning around them. It can also be a variety of other symptoms. Some people uh, describe it as a lightheadedness or just a feeling of unbalance in general. So the most common type of vertigo that a physical therapist will treat is called benign positional paroxysmal vertigo. It's also known as BPPV, so the shortened version of that. This is the most common type of vertigo that people will experience, and it can be treated with physical therapy. BPPV accounts for about 20 to 53% of the dizziness cases in Iowa. So most people that would go to a doctor for these symptoms, majority of them can be related to this BPPV. So some just general vertigo facts or statistics. 5.6 million patients are seen each year in the United States for BPPV. Prevalence of vertigo is increased with age, so as you get older, your chances of getting this can increase. It also increases if you've had a similar symptoms or a similar case of this type of vertigo. As you get older, that can increase your risk of having vertigo. 86% of people that have vertigo experience an interruption of daily activities. So most people will have difficulty with walking. They may not be able to do normal daily activities due to the severity of their symptoms of vertigo. So common vertigo complaints, many people will describe it as dizziness with looking up or down. So as they look up towards the ceiling or bend over to pick up something off the floor, those types of things will exacerbate the symptoms. Some people have dizziness with rolling in bed. Usually is one-sided, so if they roll to the right side, they will have symptoms, but if they roll to the left, they may not have symptoms. It's just dependent on where the vertigo is occurring in the inner ear. They'll have dizziness with getting out of bed in the morning, lightheadedness, as I spoke to before. It usually happens suddenly and usually lasts a minute or less. So most people that have the symptoms, it doesn't last very long, but they can be fairly intense during that short period of time. And then they increase with either looking up or down or rolling in bed, those specific activities that seem to aggravate it. Some people will have nausea and vomiting symptoms. And then many people will complain of loss of balance or equilibrium. So what is the vestibular system and how does it affect what we experience with this type of vertigo that you're having or may be having? The vestibular system helps us with our balance. So we're able to sense where our head position is at, whether it's looking up or down or side to side. We can determine those things, the signals that we get from our inner ear, and send signals to our brain that help us determine where we're at in space. So that's that third point, bullet point there, is spatial orientation. We know where we're at in space. If we're bending forward, we know that our body is in that position, and just helps us to get to a point where we can balance and stay in a balanced position. So if you look at the inner ear, it consists of a couple different things. The cochlea is where we sense vibration, and those are interpreted through the nervous system and sent to the brain and helps us determine sound. But part of that inner ear is also the semicircular canal, and you can see in this diagram, helps us to understand where that is in relation to our anatomy in our ear. These semicircular canals that sit above the cochlea, they are there to sense position. So if you look at that at a deeper level, if you take it down to the anatomy smaller into this diagram here, there's these semicircular canals. They are in a position, in different positions that help us to sense that movement. So there's tiny crystals, which are these little crystals on the diagram that will move inside our ear, and they send signals to our brain to help us determine where we are at in space. Now our next diagram will show that in just a second, but that helps us to maintain our balance, and it senses the movement of these crystals to help give us an indication of where we're at in space. If those crystals get outside of their normal place into this semicircular canal, it will send signals to our brain that are interpreted as a spinning, or in general, it'll just give us different symptoms that won't interpret them into a normal balance or equilibrium. And that's when we feel or experience that vertigo or that spinning sensation. So if you look at it, if you even break it down further into the cilia, we talked about the otoconia, which are those little crystals. They move in the ear. It's embedded in this otolithic membrane. So that's that membrane will allow these little tiny hairs called cilia to move inside of our inner ear, and those interpret that and send that to our brain to tell us if our head is looking up or down or moving side to side. So as you see in this diagram, the head is upright in this position. The otoconia are flat. The cilia are flat. When we bend forward, the otoconia will move forward. That slides those hairs forward because the otolytic membrane will slide forward and sense the movement of those hairs, and that is interpreted in the brain and tells us that we're leaning forward. So how does physical therapy help with that? So as I talked about in that previous slide, if those otoconia or those crystals get dislodged or moved into a different space, they'll need to go back to their normal place. And so what we can do is called the Epley Manuever. And what that is a series of head positions that we move you into that help to move the crystals back into their normal space. And as you can see from this diagram, there's several or a few different positions that our head needs to be into, that we're trying to move them through those semicircular canals in the ear to help position those so that we get our more normal equilibrium or more normal signals to the brain. So one thing that I would encourage you to do if you've experienced these symptoms in the past, or experiencing them now, to go to our website. It's kineticedgept.com, and set up a free injury screen. We can take a quick look at you. There's a really quick test that will tell us if BPPV is the specific diagnosis that you have. That will help us to determine if we can treat you with that Epley Manuever, and it's usually fairly effective. I think the recent statistics are that 80% of the people that have BPPV get relief from one treatment of the Epley Manuever. A pretty simple step that you can do to kind of get rid of this dizziness and the vertigo that you're experiencing. If there's consistency to your vertigo, it'll help us to determine whether you need to go through some exercises or different things that you need to do to help alleviate the symptoms and hopefully get them to stay away and not come back. If you have any questions, please let us know. Here's our 1-800 number and our website. My email is also at the bottom of this page here. If you have any questions about this, please contact me, and hopefully we can get you some relief and get rid of some of your symptoms.